All right, Nico, can you say welcome to another episode of Healthy Births, Happy Babies?
It's a happy episode. Happy babies.
Welcome back to another episode of Healthy Births, Happy Babies. I'm Dr. Jay Warren. I'm the prenatal and pediatric chiropractor here at the Cap Wellness Center. And this podcast is all about helping you have a proactively healthy pregnancy so you can have a safe, gentle, natural birth. And that's going to allow you to bring your baby into the world that much more gently and healthily so you can start off your family experience more powerfully than if it's full of stress and trauma and other health concerns. So if you are a fan of this show and you haven't yet subscribed, please do so. Wherever you listen to your podcast, go ahead and subscribe so you don't miss an upcoming episode. And also, if you haven't rated or reviewed the podcast and you've enjoyed it and gotten value of it, that will really help me out because that'll allow this podcast to reach more and more parents like yourself that might be missing out on this type of information and helping them along their parenting journey. So thank you in advance for that. And thank you if you already have rated and reviewed. On today's episode, I have Jen Kamel of VBACfacts.com, and I've been referring patients that I work with in my office to her website for years. The women that are coming to me for support during their pregnancy, going for a VBAC or a vaginal birth after cesarean, her website has a tremendous amount of information. She has courses set up as well as just tons of information there to empower a woman to really surround themselves with a supportive team supporting her in a VBAC and getting the information that she needs to be able to make an educated choice about this, and then also to empower the birth providers around her with the current research around the risks as well as the myths around going for a VBAC, as well as the risks of successive cesareans, which is something that really isn't talked about, but we're going to talk about that today. So on today's episode, she'll be referencing a lot of different things that she offers. I'll have all of those links in the show notes so you can get to them. But before we go into the interview, let me take a moment to introduce her to you, and then we can jump into the episode. Jen Kamel helps birth professionals and cesarean parents achieve clarity on VBAC through her educational training and consulting firm, VBAC Facts. As a VBAC strategist and nationally recognized consumer advocate, her mission is to increase VBAC access through educational programs, legislative action, and amplifying the consumer voice. She has presented at ground rounds at hospitals, educating obstetricians, maternal fetal medicine specialists, midwives, residents, and midwifery students on the latest VBAC evidence, and she's testified multiple times in front of the California Medical Board and legislative committees on the importance of VBAC access and has served as an expert witness in legal proceedings. She envisions a time when every pregnant person seeking VBAC has access to unbiased information, respectful providers, and a community support so that they can plan the birth of their choosing in the setting they desire. So, with no further ado, let me switch over to my conversation with Jen Kamel. All right, Jen, welcome to the podcast.
Hey, thank you so much for having me today.
Yeah, it's going to be a great episode because this is a topic, VBAC is a topic I get a lot of questions about. Either in my clinic, I'm seeing patients that are wanting to go for a VBAC, or just tons of questions in general. And I've known about you for years. I heard you on a previous podcast a couple years ago and learned about your site. And so I've always referred people to your site as a starting point. And now with this episode, we'll have some personal information from you as well. But before we go into kind of all the myths and getting a person really informed, it was your personal experience doing a vaginal birth after cesarean that kind of started you on this path. Like, how did your personal experience get you to the point where you are now kind of a leading figure in VBAC information?
Well, my C-section and then my VBAC really transformed me. I not only learned a lot for myself, and in that process, I also learned how many other parents there were out there who were trying to navigate their options and how many professionals were really unclear on the facts and wanted to learn more, but just didn't either have the time or the skills to dig in deeper. And so that is what brought me to creating VBAC Facts, so that way I could make all the information that I had assembled for myself easily accessible to others, so more parents understood the facts and more professionals felt confident talking about the facts.
Right. Now, did you start doing all this research for VBAC for yourself, like right after your cesarean, or was it when you became pregnant and in that pregnancy mode of immersing yourself?
Well, I was reading books on parenting when I was like 12 years old.
Really?
I love to
Wow.
read. I was reading like Dr. Spock. I remember seeing it on a shelf in my bedroom, and I pulled it off and I was reading it. And I just love to learn, and I'm a really curious person. And so when I had my C-section and my OB told me, you're going to be a great candidate for VBAC. So, just keep that in mind. And I love that he planted that seed in my brain.
Yeah.
Because so many parents come out of that first C-section and they may or may not know that VBAC is an option, or their doctor might tell them outright, it's not an option for you.
Mm-hmm.
So, but then when I went out into the world, my friends and family were like, oh, it'll be so convenient the next time around because you can just schedule a C-section.
Right.
And I was like, wait a sec. Like, okay, so my doctor told me I was a great candidate, and yet everyone around me is acting like this is a totally kooky idea. And so that's when I really wanted to learn more. Like, why do people believe this? Why is my doctor telling me something differently? And so that's really when my journey began. And also interacting with other parents online, because there's a lot of misinformation in message boards. And so someone would say something, and I would just ask, where can I learn more about that? And they didn't know, because they were just repeating what someone else told them. Mm-hmm. And there was a very low bar for verification of information. And a lot of people believe stuff because some faceless person who's been kind to them in a message board said it. And they might have heard it from some other faceless person. And so I just really wanted to figure out, like, okay, so people say 50% of uterine ruptures occur before labor. Is that true? The person who said it had no idea. Other people in the group would argue and debate about how this was true, but yet no one had any sort of evidence that they could point me to. And so it was stuff like that I just started digging in. I was like, well, I'm kind of curious. I want to know what the answer to this question is. And I ultimately found that was false. But it's only through finding that, digging through medical research, finding a study that's parsed out that one little variable. Many studies don't. In fact, the overwhelming majority of studies don't. And so trying to find those little facts is very difficult and extremely time consuming. And when you're trying to get a comprehensive view about VBAC, that can take up a lot of your time.
Right. And I can, speak for myself, but then also for our listeners, like I sounded surprised when you were like reading at 12, those kind of things, but looking at your site and what you've accumulated, like I can tell that's a strong suit of yours, like being curious, researching, but you're also a very good teacher. So like that's a great combination for all of us. So I want to thank you for that. But what did you in your research find, like was there a shift as far as the paradigm around VBAC where maybe earlier on historically VBAC was more common and then it shifted away from that? Or has it always been the case that once a C-section, always a C-section?
Well, that phrase in and of itself has a really interesting history, because at the time when that phrase was coined, it was not meaning that women should always have a repeat C-section. It was coined back I believe it's in the early 1900s. And when we look at recent American history about VBAC, in the 1990s, VBAC rates were actually increasing. And as hard as it is to believe now, given that over 40% of American hospitals ban VBAC, meaning they require women to have repeat cesareans. Back in the 1990s, the early to mid 1990s, it was actually required to have a VBAC in some hospitals and some facilities. And that's for a variety. I know, isn't that interesting? It's for a variety of reasons. One of which is that people don't do very well in shades of gray. People really want to be told this is right and this is wrong, or this is safe and this is dangerous. And the challenge was medical insurance companies started saying, VBAC is less money for us to pay for. We really think more people should have this option. But because we don't do well with shades of gray, some hospitals said, okay, everyone's going to have a VBAC now, regardless of your candidacy, regardless of our nurse to patient ratio, regardless of your risk factors, everyone's going to have a VBAC. And as a result of that, we had some bad outcomes. We had some very high profile lawsuits. We had large judgments. And a lot of people started questioning whether it was really wise to be offering VBAC, to be encouraging this, because we didn't understand at the time the serious risks that can come with repeat cesareans. And so at that moment in time, people were saying, okay, so you can either have a VBAC, which has this risk of uterine rupture, or you can have a repeat cesarean, which at the time seemed to be a very benign choice. And so more and more people, and this also had other factors like ACOG's VBAC recommendations, which I dive into quite a bit into my online trainings because it is very convoluted. What ACOG says is pretty straightforward, but how people have interpreted that really impacts hospital policy.
And when did those recommendations come out?
So in 1999, ACOG first introduced the phrase immediately available, but no definition was provided for what that meant. And so hospitals defined it in many different ways, resulting in restrictive VBAC policies or outright VBAC bans.
And it's so fascinating to know that, like, with the, this looking at VBAC risk was really generated from, in an insurance sense, the opposite. They were forcing women that weren't good candidates for VBAC into situations that put them at risk. I had always really ever thought it was just, the insurance companies determined it was cheaper to do the cesarean, so let's push that.
Yeah, cesareans are actually more expensive for medical insurance companies to reimburse. And some medical insurance companies have reached out to hospitals that have high cesarean rates and say, look, your cesarean rate is completely outside of the norm. We're paying you way too much money for all these cesareans, many of which we believe are unnecessary. You need to reduce your cesarean rate. And hospitals have responded and have been able to do that, which just goes to show that if there is motivation, and there's a variety of different ways to motivate hospitals, change can be made.
Yeah, it's in our environment here at the CAP Wellness Center. I work with Dr. Kapitanakis, he's known in San Diego for supporting VBAC, and so we have a lot of women coming to him successfully doing VBAC, and of course there's times where it isn't, but it is something that the birth provider is a big part of deciding when you can have or be in a successful point, where you're going to be supported in that. But a lot of women don't even get to that point to ask the provider yet because of this paradigm. And most of the time it's saying like, well, if you try and do a VBAC after you've had a cesarean, you're going to either die yourself or the baby's going to die because of uterine rupture. And what is the actual facts around that?
So the risk of uterine rupture after one prior low transverse cesarean, and low transverse means it can be called a bikini cut scar, so it's low on the uterus. So after one prior low transverse cesarean, the risk of uterine rupture is about 0.4%. That's 1 in 240 labors. And those are among spontaneous VBACs. So those are VBACs that start without any sort of medication. So the woman goes into labor naturally. Or it can be as high as 1%, and that represents the risk of uterine rupture during a induction with Pitocin.
Okay. And what are they for, say, a first-time vaginal birth?
Well, among a first-time mom, the risk of uterine rupture is, if I recall correctly, it's about 1 in 14,000.
Okay.
So it's extremely rare for a woman without prior uterine surgery to have a uterine rupture.
Right. But then there are a lot of risks that I believe aren't really talked about nearly as much around risks of repeat cesareans. What have you found there?
Absolutely. Well, we have lots of evidence documenting the increasing risks that come with multiple prior cesareans, the most serious of which are placental abnormalities called accreta, increta, and percreta. And those are all different degrees of an abnormal attachment of the placenta to the uterine wall. And those complications are associated with a high risk of hysterectomy, blood transfusion, ICU admission, as well as maternal and infant death. And when we talk about maternal and infant death, for accreta, that's 1 in 14 moms who have accreta. So that is a shockingly high maternal mortality rate from a complication.
Right.
And that's something that 93% of people pregnant after 1, 2, or 3 cesareans are never informed about. All they hear are the risks of VBAC.
Right. And is that something that is typically assessed by the OB going into the second or third pregnancy?
During the ultrasound, they are generally looking for where the placenta is attached, but they may not, I don't know how routine it is to be ruling out accreta.
Okay. But can it be visualized?
About 60 to 80% of accretas can be diagnosed prenatally,
Okay.
but that means we have about 20 to 40% that are surprises in the delivery room. And those moms and babies have the worst outcomes because accreta requires a highly sophisticated multidisciplinary response with ample blood supply. And if a facility is unable to offer that, that mom and baby are going to have are more likely to have a bad outcome.
Right. And besides, or in addition, I should say, to the uterine rupture risks, myths around going for a VBAC, what do you find women also in a paradigm sense being challenged by, either their own fears around it because they heard it, or, and what I'm finding here at Capilano is like women that are wanting to do VBAC, like trying to find a community around them that supports it and having information for those women or other practitioners that might kind of give them a look saying, oh, you're going for a VBAC, huh? What are those other things that they can become informed about so that they have better information to work with those kind of feelings?
Well, I have an online course called the Truth About VBAC for families, and that provides families with all the information that I wish I had when I was evaluating my options rather than having to accumulate it all for myself. So making an informed decision means that you understand a variety of things, and that includes not only the risks and benefits of VBAC and repeat cesarean, but also the likelihood of specific complications, looking at mortality rates for you and your baby, understanding the real risks and data. And getting into that information provided me with a lot of peace, as surprising as that may sound. But for me, knowing whether something, having a hard number and knowing the answer to the question gives me peace.
Yeah, it takes that fear factor out of it. Well, you might be fearful of the number, but it's more realistic, I guess, is the word, rather than that it's a fear of the unknown versus the fear of, okay, well, this is what my situation is. Let me make a good choice that's informed.
Well, exactly. And the honest answer is that there is no risk-free way to birth.
Yes.
There are unlikely, though serious complications that can occur with VBAC or repeat cesarean. And those are different types of complications. So it's really also considering how many kids you plan to have. That's another huge factor. So there's a lot of different things to consider. And unless you have someone there who can lay that all out for you, it can be very easy to miss some critical factor. And sometimes doctors just don't have the time to go through the information at that level of detail because they have to see so many patients during the day. And so that can be a real challenge. And so that's where I try to fit in order to help get parents get up to speed as quick as possible while providing them with a comprehensive understanding of the bigger issues.
Right, and that's we definitely find that here, that even though a woman might be coming to us because they want support, with their VBAC with the Dr. Cap, as well as at the Wellness Center here, getting adjusted and acupuncture and yoga, being really healthy going into it, there is still so much information that we refer specifically to you and some other VBAC classes that we teach, so that it fills that gap, as you said, that might not be able to come from the provider. And thankfully, these women have a provider that want to support them in it. But many women aren't, and so how do you recommend a woman like in their community to try and find someone that truthfully is supportive of VBAC? Because I've heard tons of stories of women here in San Diego where they were told by their OB when they first got pregnant, like, oh yeah, we'll support you, we'll see how things go, and already at 26 weeks they're scheduling a C-section.
Yeah. So I have a list of questions up on the website. If you go to vbacfacts.com/questions, I have them all up there. The challenge with asking a bunch of questions, you can find lists of questions all over the website and all over the internet. But you really need to have a deep understanding of what answers are you looking for, and an understanding of the research going in, because it's really easy if you are talking to someone for them to run circles around you if you don't understand the facts. So, it's great to have a list of questions. It's great to go in and get a feel for something. But if you are really trying to counter or trying to verify the information that you're receiving, you yourself need to know that information. It's like if I go in to get my oil changed and the person tells me I need an oil change, and I'm thinking, well, maybe I don't need an oil change. Well, I need to know something about what it means to need an oil change in order to make that assessment. So you need to go in informed in order to really accurately weigh their responses against the facts.
Right. So, and I like that word, like to validate, verify is what you said. So instead of going in and asking questions like, oh, okay, I got 3 yeses and 2 nos, that must mean it's supportive. It's more of not necessarily testing, but I like your word verifying of, okay, they're up to speed on the current research. The feeling I got when answering the questions, they were comfortable answering the questions and really supportive. But to reiterate what you just said for our listeners, is it comes from you being informed in the first place and then creating a team around you that supports it.
Yeah.
Now, do you do individual consultations as well with people, or is it more like our listeners like funneling into being able to take your courses?
I do individual consulting with people, and I meet with parents, with professionals, and also people who are working on legislation in states across the United States. So it really just depends on what people are interested in chatting about. I'm very clear that I'm not a medical professional. I can't give medical advice,
right,
but I can absolutely share what ACOG says, what the research says, talking about the politics of VBAC, processing your cesarean as someone who's been there. I know what it's like to simultaneously mourn having to have a cesarean while you celebrate your baby, and also the challenges that you can go through while evaluating your next birth options, whether that's dealing with family or friends or your partner. And then for professionals, I'm available to answer those burning questions that people have. Often people have a list of information of things that they just can't find for themselves, or questions on how other hospitals or how other professionals do things. So that's the kind of perspective that I can offer after doing this work for almost 10 years.
Right. And just looking through like the different courses that you've had online, it's so extensive, and I appreciate that you have the Truth About VBAC for professionals as well as for families, because it's really working with both, right, that's going to make a shift in this country.
Absolutely.
We already see at our center, there's actually a group of women periodically throughout the year that come from Mexico up here to do VBAC, because in Mexico, the cesarean rate being so high, it's not even a question of finance. So they're coming up here for a couple of months, which is a huge investment of time and energy and money, obviously. But there's so much a movement towards like regaining that as an option. Not that every woman has to have a VBAC. I mean, there's going to be women that aren't candidates, whether it's physically or maybe even mentally, emotionally, but we want it at least to be a choice rather than just being funneled and there being no options.
Absolutely. So often, sometimes people think that this is yet another black or white issue. VBACs are good and C-sections are bad. And the reality is, once again, it is an area of gray. And it really comes down to, what does an individual pregnant person want? And talking about the risks and the options that are available for them, and them just making an informed decision about what is right for them. And then being supported by their friends and family, rather than feeling like they need to justify their choices. It's really important for people to feel supported. And whether they're planning a VBAC or they're planning a repeat cesarean, this should be a happy time of growing your family rather than feeling like you're being judged.
Right. And knowing so much about the work I do with like epigenetics and prenatal psychology, that it's the stress during the pregnancy and in the perinatal period that can have such an impact. And that stress comes from not being supported in a lot of ways. I mean, there's physical stress, but if you can be supported in whichever birth you want to have, then it's better for baby, better for mama, better for the postpartum period. And we can all just have these babies coming in a happy, stress-free sense rather than a stressful sense.
Yeah.
And I think something that you mentioned too, I think is really important, is supporting a woman after the cesarean in, I think you used the word grieving, like kind of grieving. You want to celebrate the baby, but also grieving that experience. And I think that's something that happens a lot that needs to be worked with. So I appreciate that you're doing that work too.
Yeah. Well, too often people feel awkward around other people who are sad. And we want everyone else to be happy, right? We don't want the people around us to be sad. But in order to move through those emotions, we have to acknowledge them. And we have to say, yeah, this is the way I feel. And if you acknowledge it, and if a person feels heard, they are more likely to move through those negative emotions and come through the other side. But we don't process negative experiences or things that we're disappointed about by being told, stop talking about it. Look at the bright side. Look at the silver lining. I mean, it's okay to be disappointed about something. It really is. And so often parents are told that you need to stuff those feelings down. And stuffing down feelings like that is not a healthy response.
No, it's not processing through the experience. It's just shutting it off so it rears its ugly head later on down the line. Yeah, I know as a practitioner, I've learned that. Like earlier on in my career, I would go to that space, as you were just saying, of like, well, let's focus on like you have a healthy baby on the other end of the things, and I've learned now as far as like birth trauma and resolution and postpartum period, like I was doing them a disservice. I was coming from a place of wanting to help, but it was not as helpful as acknowledging, yes, you have a healthy baby, but yes, this did not go the way that you want. Let's help you identify and acknowledge that and work through it so it doesn't become an issue later on down the line.
Yeah. And, we're all doing the best that we can, whether we're professionals or we're parents, and to be constantly open to growth. I appreciate you talking about how you used to try to kind of bring in the whole healthy baby thing. It's like, I think we've all done that at some point until we've really thought, wait a sec, this is not incredibly helpful. And to always be open to learning more and growing who we are as people really helps us do our work in a more effective, heartful way.
Right. Well, in our so with all of the links you've mentioned throughout, I've taken notes. I'll make sure all of those are in the show notes for our listeners. For the listeners listening, I would definitely recommend getting Jen's Planning Your VBAC download, as well as the uterine rupture myths. Those are extremely informative, and then she can jump into the Truth About VBAC for families, and I also have the link for the questions to ask. Jen, what's the major take-home you'd like a mom listening to this, or maybe even a dad too that's wanting to get informed to support his partner from this conversation, or maybe even something we didn't touch on yet that you'd like the listeners to take heart?
I think it is really important if you are in a relationship for both partners to be on the same page. I see a lot of discontent and a lot of stress and struggle coming from two people who have different opinions about how this baby should be born. And I think it's really important for both partners to be equally invested in learning the facts and coming at this like you would any other issue in your life as a team, and really acknowledging the physical and emotional ramifications that the pregnant person will feel if they do not feel heard and if they feel forced into something that they do not want to do in order to preserve their relationship. That resentment will live within that relationship.
Right. I wholeheartedly agree with that, and would love to reiterate that as well for the dads or the birth partners, that if, I can speak as a male, like our protector comes up, right? And we think we're protecting and trying to help in that way. But again, just in the same way that a mom looking for a provider needs to be informed, like if we bring a stress around it to the birth experience, it's going to make that birth go differently than it could if you guys are on the same page. So thank you for mentioning that, Jen. I think that's really important. What about for a little kiddo that's listening? Most likely, baby's still in utero, maybe listening through mama and the earbuds. What little piece of advice would you like to whisper in their little ear?
Oh, I would love to tell them that when they fall asleep in their parents' arms and when their parent maybe lays them down somewhere so they could go to the bathroom or take a shower, to please stay asleep. Because my first child did not do that. And there were times I wanted to gnaw my arm off because she would be laying on it. Yep. And I knew like the spring squeaking in the bed would wake her up. And then you just know you're stuck, right? You're stuck there while they're napping. So please, little babies, stay asleep so your parent can do other things that need to be done.
Great advice coming from a parent for sure. I know that time thing where like, my arm's totally asleep, but like he finally fell asleep. Like, okay, fine. I'm sure it'll wake up in an hour. Hopefully I'll be okay. Yes, I have to pee, but like, no, his diapers aren't close enough for me to use one of them. I mean, it's ridiculous, the things we do to keep our kids asleep. Not that I've ever done that. I've not done that, listeners, pee in one of my kids' diaper to try and keep him asleep, but I've thought about it. Well,
absolutely.
Jen, thank you so much. It's a pleasure to have you on. I've been referring people to your site for a long time. I'm really glad you are here to have this conversation and be another resource for people and listeners. Definitely go to her site, become a part of things, get informed, use her courses. It'll make this birth that much happier and healthier for your little one and for your whole family.
Yeah. Thank you so much for having me. This was great. And best of luck to all the listeners. You're going to totally rock this birth, no matter how it plays out.
Yes. Hi, it's Dr. J again, and I want to thank you so much for listening to the podcast. It's something I really enjoy doing, and I, as a parent, learn a ton from these experts coming on and sharing their wisdom, so I hope you're getting a lot out of it too. And I want to share something else with you. I've created a guide called the 40 Ways to Connect with Your Baby During Pregnancy. It's full of simple things you can do on a day-to-day basis that will help strengthen that bond that you have with your baby. It's a free download. You can go to my website at drjwarren.com/40ways and just enter your email. I'll send it right to you. You can download it and start working on it right away. All of the research that I'm learning in the fields of epigenetics and attachment parenting is showing that the more bonded you are during your pregnancy with your baby, the better the birth is going to go and the better parenting is going to go, because you have that strong foundation, a strong connection to build upon. So go again to my website. It's drjwarren.com/40ways and get that free guide. And again, thanks for listening.